Hello and welcome. Today we're diving deep into a common yet often misunderstood digestive condition, peptic ulcers. We'll explore what they are, why they happen, how they're diagnosed and treated, and what you can do to prevent them. So, let's get started on understanding peptic ulcers. Peptic ulcers aren't random occurrences, they have specific causes. The two major culprits are infection with the bacterium Helicobacter pylori, often shortened to H. pylori, and the long-term use of nonsteroidal anti-inflammatory drugs, or NSAIDs like ibuprofen and naproxen. Less common causes include Zollinger-Ellison syndrome, a rare condition that causes the stomach to produce excess acid, and certain medications like corticosteroids and selective serotonin reuptake inhibitors, or SSRIs. Let's break down how peptic ulcers actually form. Normally, the lining of your stomach and duodenum is protected by a mucus layer. H. pylori can disrupt this protective layer, allowing stomach acid to damage the underlying tissue. Similarly, NSAIDs can reduce the production of prostaglandins, which are important for protecting the stomach lining. When the protective layer is compromised, stomach acid and pepsin, an enzyme that breaks down proteins, can erode the lining, leading to the formation of an ulcer. Peptic ulcers affect millions worldwide. It is estimated that approximately 10% of people develop an ulcer at some point in their life. The prevalence varies geographically, with higher rates in regions where H. pylori infection is more common. While ulcers can occur at any age, they are more frequently diagnosed in older adults, particularly those who regularly use NSAIDs. The symptoms of peptic ulcers can vary in intensity from mild to severe. The most common symptom is a gnawing or burning pain in the stomach, often between meals or at night. Other symptoms may include bloating, heartburn, no vomiting, and in severe cases, dark or bloody stools, which indicate bleeding in the digestive tract. Sometimes, ulcers can be silent and only discovered when complications arise. Diagnosing peptic ulcers typically involves a combination of medical history, physical examination, and diagnostic tests. A common test is an upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, stomach, and duodenum to visualize the lining. Biopsies can be taken during endoscopy to test for H. pylori. Non-invasive tests for H. pylori include breath tests, stool tests, and blood tests. Barium swallow X can also be used, although they are less accurate than endoscopy. Peptic ulcers are primarily classified based on their location. Gastric ulcers occur in the stomach, while duodenal ulcers occur in the duodenum, the first part of the small intestine. Both types share similar causes and symptoms, but their treatment may vary slightly. The primary goals of treatment are to relieve symptoms, heal the ulcer, and prevent recurrence. If H. pylori is present, treatment typically involves a course of antibiotics to eradicate the bacteria, along with medications to reduce stomach acid. These acid-reducing medications include proton pump inhibitors, or PPIs, and H2 receptor antagonists. Avoiding NSAIDs and alcohol can also aid in healing. In rare cases, surgery may be necessary to repair a bleeding or perforated ulcer. Preventing peptic ulcers involves addressing the primary risk factors. Avoiding long-term use of NSAIDs whenever possible and taking them with food can help. If NSAIDs are necessary, your doctor may recommend taking a PPI to protect your stomach lining. Practicing good hygiene, like washing your hands thoroughly, can help prevent H. pylori infection. Managing stress and avoiding excessive alcohol consumption can also contribute to better digestive health. The prognosis for peptic ulcers is generally good with proper treatment. Most ulcers heal within a few weeks with medication. However, without treatment, ulcers can lead to complications such as bleeding, perforation, or obstruction. Recent research is focused on developing new therapies for H. pylori eradication, as well as exploring the role of diet and lifestyle factors in ulcer development and prevention. Additionally, advances in endoscopic techniques are improving the diagnosis and treatment of bleeding ulcers. Staying informed and consulting with your healthcare provider are crucial for managing this condition effectively.